let's just start with SUPO. Why don't you talk a little bit about how Nigeria is leading to coordinate private sector investments in digital health?
Good afternoon. Like everybody else, I'm quite happy and grateful to be back here. I was at one of these forum discussions last year. Very quickly, I'd like to talk about stuff that's happening in Nigeria. But because I wear two hats, I am the director of the Health Strategy and Delivery Foundation's ICT for Health project. It's a project that's focused on supporting the Nigerian government to implement digital health strategy. I'm also the director of a new organization that's called the African Alliance of Digital Health Networks. The African Alliance is essentially a peer learning network that seeks to leverage a lot of the work that's been done around the continent, essentially to capacitate the continent to get best possible deal in terms of output, input around digital health. So I'd like to talk about the Nigerian context and then get a bit wider and talk about the continent. Nigeria's digital health strategy was approved for use by the National Council on Health. That is the highest policy-making body in health. In April 2016, actually next week we're having another National Council on Health meeting. These things happen every year in case of emergencies. But after that, the Ministry of Health set up an ICT department. And within that ICT department, they created and domiciled a national e-health program management office that was charged with the day-to-day operations of the implementation. Since that time, the ministry under the leadership of the Honorable Minister of Health has set up the necessary governance structures as were detailed out in the strategy. So there is governance in place. There is some capacitation and there's some strengthening of that structure, and the various government officials who have the responsibility of midwifing the implementation. And I will be honest with you, it's not been an exactly smooth journey. Like anybody who works in LMICs will tell you, capacity is one of the biggest challenges. Unfortunately, as nice and as wonderful as digital technologies in health is, it's still relatively in a nascent stage, so there is a huge lack of capacity. But I will be honest with you, having said that, having elucidated those challenges, there's been a fair bit of gains we've made. The governance is in place. There's humongous, that's a word my son likes, humongous political will from the minister. The National E-Health Steering Committee is chaired by the Minister of Health and the Minister of Communication. And the National E-Health Program Management Office is actually starting to take a lead and provide some coordination and guidance to digital health investments across the country. Some time ago, that office, working with some partners, completed an inventory of digital health initiatives across the country as a first step in being able to prioritize services and applications and use that to advise not just the ministry, not just the partners, but the general digital health ecosystem across the country on direction of investments. I am also very happy to say that we're starting to see in a number of the states of the country, a number of digital health implementations that are springing up. More often than not, they are public-private partnerships. I think it was in May, about early May, Abia State is a small state in the southeast of the country. They partnered with the private sector player and they launched an e-health support initiative where callers could call into a call center that was staffed by medical doctors and get advice or get referrals. There are more and more players who are developing electronic medical record systems and are starting to talk to government or even go in and talk to private sector facilities on the tip of, don't buy the electronic medical record. Don't buy computers. partner with us and we'll work out a deal where we'll get paid over time. So we are getting some public-private partnerships. We are also getting some private-private, and we are getting a fair bit of public-public partnerships. The National eHealth Program Management Office is staffed by folks from the Federal Ministry of Health's ICT department, a number of the other departments within the ministry, and a couple of ministries, departments, and agencies in the technology sector. So it's multi-sectorial. We are getting better. There is hope on the horizon. And personally, in my opinion, one of the best things is the government is showing leadership. My experience has been private sector's biggest challenge with working with public sector has been a lack of direction and a lack of commitment. When you have direction, governance, coordination, and commitment, transparency is not too far down the road. Once you have transparency, there's a better sense of a level playing field. Private sector is a lot more comfortable to jump in and play. So that's Nigeria. I'd like to just widen the breadth a bit and talk very briefly about Africa. Now, over the last day and a half, there's been a lot of discussion as we discuss transitions and the shrinking fiscal space, whether it's because countries are maturing economically or developmentally, or because basically donor assistance for health is just shrinking. But there's been a lot of stuff about the need for political will. Ladies and gentlemen, I would ask you, whose political will? Every conversation I've heard has talked about political will on the part of the public sector, on the part of the government. Question I ask is, do the donors and the partners have the political will to make what they say happen? It's very easy. In Nigeria, there's a proverb that says when you point one finger at somebody, all other four fingers are pointing to you.
I've heard that before.
So I will challenge all donors and partners in this room. When you talk about political will and expect political will from the government, is there the appropriate political will on the part of the donors? It really doesn't matter how much you've invested in global health, specifically in digital health. All your investment will come to naught. If, no offense, all your investments will come to naught if you transition out without making sure there's the appropriate skill set and capacity to continue to make things happen. Yesterday we heard about the quantum of skilled labor in global health that exists in low and medium income countries. And once the donors transition out, you would have a labor force that is not used to earning the regular wages that is available at in the country. You're going to have a huge problem because you're going to have some guy who was earning $2,000 a month suddenly be out of a job, and the only job available in country is going to pay him $400 a month. What's he going to do? He's going to leave the country. So if you are not careful, you're going to leave the countries in a worse state. You would have put in all the wonderful infrastructure, put in all the wonderful programs, but there will be nobody to run it. So again, I ask, whose political will are we talking about? Second thing I want to talk about is, which I'm going to be very quick about this, which you need to focus on as you begin to talk about transitions. You need to capacitate digital health leaders for and in the continent. I'm talking specifically about Africa now. It's not just about putting all the infrastructure in place, putting the systems in place. You need to help those countries build leaders in digital health who would be able to fulfill the role the donors and the partners play. And let us be honest, it's really like raising a child. My dad died about 3 years ago, but by the time my dad died, our relationship had evolved from this nasty man who never wanted me to play to this nice guy who we just didn't understand each other, to eventually this really superb guy I used to call and get advice from. And that's what will happen in the relationship between the donors and the countries. It would evolve. Like Dr. Pate said yesterday, it's not really going to be a transition. It's going to be an evolution. We have some engineers coming from Zipline in Rwanda, I understand, who have come into the States and are training engineers in the United States on how to salvage old equipment and use that to repair drones. So the relationship between the global north and the global south will not always be one way. We need to seriously stop assuming all the aid, all the benefit is flowing to the south. There is some benefit coming back this way, and there's a need to properly articulate and place that in the evolving relationships. We need to start looking seriously about the concept of the business of global health. It is a business. Ben, it's unfortunately he stepped out. Ben was talking a few minutes ago about M-Pesa. Why did M-Pesa become such a success? M-Pesa did two major things human beings need. It met a fundamental need. It allowed people who were normally outside the formal financial sector to suddenly have financial inclusion. So, to all intents and purposes, M-Pesa was the first real articulation of universal financial coverage. Ladies and gentlemen, until you use digital technologies to make health and create an M-Pesa for health, you will not achieve universal health coverage. So you need to build capacity, you need to build understanding about the business of global health, but the business of digital health. When you do that, you would suddenly have, coming out of a lot of these LMICs, digital health entrepreneurs who will be able to find business to sustain them and help grow their local economies and will be useful to you. Finally, I like talking a lot, but I'm going to keep this very short now. Finally, PPPs do not always equate cash or checks. I had the ExxonMobil folks talk about more often than not the requests they get are for money. True. But part of the problem why that happens is, are we doing enough to appropriately educate the public sector that PPPs do not always equal cash or check? One of the programs the African Alliance of Digital Health Networks is going to be running is a digital health leadership program. And we're going to be setting up a fellowship where we're going to train, working with WHO and the ITU, train across the continent a whole bunch of people and give them basically what I would describe as digital health 101 skills. And then we're going to help them get industry world-class certification so they're better able to do their jobs. Now, when you take those people and you match them with mentors, and so I have some guy who works in Liberia, some guy who works in Malawi, or some guy who's a consultant in South Africa, when I have him matched up with some of the people in this room, and you're spending an hour and a half a month just supporting him, setting him assignments, following up on him, the hope is you will transfer basic efficiencies, which is really what the private sector is most known for, basic efficiencies to him. Those basic efficiencies would help him do his job better, would help him deliver better quality outputs. And at that point, ladies and gentlemen, indeed you would have done the perfect version of public-private partnership. Thank you.